Okay, good morning, everyone, and welcome to our Healthy Northeast Ohio webinar. We are going to go ahead and get started. I think our participants that we've been admitting has slowed down a little bit, but we'll of course continue to admit everyone as we get started this morning. So thank you for joining us. We're really excited to have you all with us. We're happy to get started on this webinar. We are using Microsoft Teams this morning, and because of that, we have muted all lines to maximize audio quality. If you have any questions or concerns, comments throughout our presentation this morning, please do put those in the chat function and we'll be happy to address those. And of course, we'll leave time at the end for questions regarding any of our content this morning. And so with that, if you haven't already done so, please do add your name and organization to the chat. I know many of you have been doing so as you've entered our room this morning. So thank you for that. This gives us a little bit of a sense of who we have joining for today. And we'll go ahead and start with some introductions of our team. My name is Libby McGraw. I am the Regional Community Health Improvement Manager for Healthy Northeast Ohio. I am based at the Center for Health Affairs in Cleveland, and I serve as one of two local site administrators for healthyneo.org, which you will be seeing plenty of in just a few moments. And Sarah, I'll invite you to go ahead and introduce yourself.
Good morning, everyone. Thanks for joining us. My name is Sarah Zabo, and I am a data analyst at the Cuyahoga County Board of Health, and I serve as the data analyst and the other site administrator for.
Thank you, Sarah. So for today, we are going to be providing an overview of the Healthy Northeast Ohio platform, including reviewing some of our data tools and indices and reviewing additional website features and resources as well. And like I mentioned, we are going to leave time at the end for questions. We are also recording this, so if you find that this is helpful to you and you would like to share it out after, we will be making this link available through YouTube. But again, please do feel free to add any questions to the chat and we'll be happy to address those. As for our objectives this morning, here we have just a few. If you are unfamiliar with our efforts and this is your first time joining us, this will provide some very useful high-level information about how to use the healthyneo.org site. And if you have been with us before and you are a little familiar with our efforts, some of this might serve as a nice refresher, especially if you've visited the site just a few times and are maybe looking to deepen your experience with the website as well. At Healthy Northeast Ohio, our mission is to improve and support community health across a 9-county region by providing stakeholders with access to vetted population health data and resources through a publicly available platform. We did launch healthyneo.org in late 2019. We currently on the website house about 300 health and quality of life indicators, and these are available at various geographic locations, which makes it very appealing to a lot of our partners and site visitors because they can have a very granular look at the health needs and health status of their communities. In addition, we have some demographic variables that are available, as well as tools and resources that can all support community health improvement efforts. This site is hosted by Conduent Healthy Communities Institute, and that is the vendor that we work very closely with, and they are also the ones that are actually responsible in the large part for updating and maintaining the data that you're going to be seeing on Healthy Northeast Ohio. We do serve a 9-county region here in Healthy Northeast Ohio, as you can see in the middle of our slide. Those counties include Ashland, Ashtabula, Cuyahoga, Geauga, Lake, Lorain, Medina, Portage, and Summit counties. The Center for Health Affairs and the Cuyahoga County Board of Health, we work very collaboratively on this program, and we do continue to be supported by a grant through the Health Foundation here in Cleveland, as well as some partner contributions from across the region. So that's again just a little bit of background information about who we are and who we partner with, and of course you'll be seeing a lot of those data features that I mentioned in just a few moments when we move into our site demonstration. And here we have all of the partners that we are currently very actively engaged with. So we have the pleasure of coordinating with many of the hospitals, public health departments, community-based organizations, and even coalitions across our 9-county region. So we thank you all for your continued support. I know we have some partners from these organizations on the webinar this morning. So thank you again for your support and participation. Healthy Northeast Ohio can be utilized to understand and explore the needs of a community. It can help with prioritizing health needs. Data can be visualized in very dynamic ways, which you're going to really get a taste of as we move into our demonstration. And all of these things can assist with taking action and ultimately influencing change in your own communities. And so some of the ways that this can be done, we have a couple items listed here of examples of ways that the website can be utilized. So whether that be through community health needs assessments or community health implementation plans, of course, things such as grant applications, publications, presentations, and so forth. These are all ways that the website can be really efficient in supporting your own community health improvement efforts. And we are just about ready to move into our website demonstration. But before we do so, we are going to take a few moments to launch our first poll in order to get a sense of how familiar maybe all of you are with healthyneo.org. And so with that, we have our first poll question. You should be seeing it through menti.com. And unfortunately for me, it's cut off because I'm in presenter mode. So Sarah, I might ask for you to read out that number. But if you go to menti.com in either your web browser or even on your mobile device, when you enter that code that should be listed at the top of the screen that you're seeing right now, you'll be able to participate in our poll this morning. So we do kindly request and thank you in advance for your participation. And then yeah, Sarah, if you could read that out loud for me,
Sure.
that'd be great.
Absolutely. And I did put it in the chat, but if, as Libby said, on your phone, it's easiest if you just go to menti.com and then the code is 22042086.
Thank you, Sarah. And it looks like we do have success, so that's great. Always with these polls and with different interactive opportunities on webinars, I know the technology is half of the battle. So it looks like we're getting some results coming in with a few who have used it, some who have used it a few times, a couple who use it frequently. So this is great for us to see because again, this webinar might serve as a great refresher, but if you're brand new to the website and to the platform, you might walk away with some useful information about how you might use it moving forward. So we'll leave this up for just another moment or two, and then we are going to move right into our demonstration. Still have a couple coming in. This is great. So we have quite a few who have used it a few times before. So again, maybe some of the different indices, and we have had some updates over the last year. So if you perhaps joined us last year sometime, there may be new information that we will be sharing today that might be useful to you. Okay, great. And with that, we are going to move into our website demonstration. So pardon me for one moment as I get our website up and running. And Sarah, I see your screen. So here I'm going to go ahead and ask if you can confirm if you can see my screen. Thank you so much. Okay, great. So we are going to start by providing an overview of our Healthy Northeast Ohio homepage. Again, this can be visited at healthyneo.org, and this website is publicly available, so you will notice that there are not any special logins or permissions that are required to enter the site. The top section of the homepage and of the whole platform will remain the same as you navigate through different pages. We do have this navigation bar, which can enable you to click on different web pages by hovering over them. If you start clicking through the website and at any point, if you are interested in going back home, you can always click on the logo in the top left hand of every page, and that will take you back to our homepage. And we also have a couple icons that I'd like to just briefly point out in the top left, options to either print, create a PDF, or even to create a URL of the page that you are visiting. So those might be some functions that are useful to you. The homepage features some highlighted information and content. We also have a search bar to allow for some easy keyword searching. We have a little bit of background information here, as well as access buttons for our county specific web pages. These can also be accessed up in the top at the navigation bar. We have some demographics data currently highlighted. So again, these are some quick ways to access that information for your own community. We have a what's new section where we highlight things like webinars. This webinar for this morning, you may have seen highlighted here, some of our announcements. And this is also where we will even add local success stories, which we can mention at the end of our webinar today as well. But if we have some really great opportunities to highlight the work of our partners and ways that they've been able to utilize healthyneo.org, we typically work to create a success story around that. And we have a couple that are currently live. We have a couple that are in progress at the moment, but we do highlight those in this section as well. So if that is something of interest to you or others in your organization, please let us know, and we'd be happy to work with you on that. Also on our homepage, we have our data spotlight. This is routinely updated with one of our data indicators on the website. And then at the very bottom, you'll see that we have a scrolling list of all of our partners available. And if you click on any of their icons here, that will take you to their own respective websites. Next, we are going to visit one of the county-specific web pages. And again, you can access those through these buttons on the homepage or through Explore by County dropdown. And you can go ahead and click on the county of your choosing. For today, I'm going to go ahead and use Cuyahoga County's page as our example. All of the pages are going to look very similar to this one. So again, we have 9 county-specific web pages, and this page typically includes some background information about that community. We have a couple links to county health rankings, health outcomes, and we also have some links to access the data for that specific community. So here we have buttons for the demographics information, our socio needs index suite, also all of the data indicators that are available for that as well. And if you continue to scroll down on these pages, you'll start to see any of our community health reports and documents that are available for that specific county. So this includes community health needs assessment reports, community health improvement plans, and so forth. So again, we are on the Cuyahoga County page for right now, but if you visited any of the other county specific web pages here, they are all going to look very similar to that, just with a little customized content. And the next page that we'd like to preview is our demographics dashboard. Now this can be accessed through Explore Data and through the Specialty Dashboards flyout, but you can also access this right through a county specific web page as well. So I'm going to go ahead and click on this, and this will take us to the demographics specifically for Cuyahoga County. And this page includes about 250 demographic elements available at the state, county, and zip code levels. And you can change the view by clicking that drop-down arrow. We have different tabs at the top here that can allow you to view the different topics such as housing, education, race, population, etc. Again, you can use that drop-down menu, and this information is updated annually. So we are viewing this for Cuyahoga County. If you wanted to view all the demographic variables available, you could click on this purple icon in the right top-hand corner. And as I start to scroll through this page, you're really going to get a sense of how dynamic many of the data visualizations on the platform are. And you'll start to see this throughout the whole presentation this morning too, especially as Sarah discusses a lot of our data indicators as well. So I'll just scroll for a moment here. And one of the things I'd like to point out too, and again, you will hear this reiterated, is that these visualizations are really great because they can be exported and downloaded. So if you were interested in adding population by age group for Cuyahoga County into a presentation or a grant report, you could download this exact graphic by clicking on that symbol in the top right-hand corner, and you could download that as a JPEG, a PDF, and you could include that as you so please. So again, just to give you a little sense of the demographics dashboard in addition to some of those data visualizations. And I also am going to briefly point out our regional demographics data story that we currently feature. And this is a great way to view demographics for our whole region. I don't want to spend too much time on this. We highly encourage you to visit, but if you were interested in comparing and visualizing demographics across our 9-county region, you could visit this page. And again, we have these separated in different chapters that you could click on at the top, and that would take you to the respective pages, and you could also click through the arrows. So again, here we have population for all of the counties in our region, and if you wanted to include this somewhere, you could export that visualization as well. Next, I'd like to highlight our footer of every page. So this does stay consistent as you navigate through different web pages on the website. And the first item I'll highlight is our topic center, which is where you'll see these different icons. So if this is a really great way to start navigating through the site. So especially for those of you who have maybe never visited the website before, this is a great way to see what's available for a specific topic. And the website is really intuitive in this way because it brings together content that's related in a lot of different ways. And you'll be seeing that this morning as we move through the demonstration. So I went ahead and clicked on one of the icons. If you wanted to look at a different topic, you could click that drop down arrow. And here you could see you could pick a different topic there. And this does bring together different data indicators that are available on the website, different resources, and so forth. So again, just a quick trick for viewing information, especially if you're somebody who has never visited it before. Also in the bottom footer, again, I mentioned that this will stay the same as you navigate through the website. We have some about us and contact us website links. We have some information about our newsletter, our editorial policy, and one of the ones that we'd like to mention though and show you is our FAQ page. This is maintained by our site vendor, Conduent Healthy Communities Institute, but this is a great way if you're visiting the site and you have some immediate questions, such as how to cite data, how to use the indicator detail page, which you'll see in a few moments. This is a great way to get some of those answers in real time. But of course, again, we are always happy to collaborate with you on any questions, and you can always contact us as well. And with that, I believe I'm going to turn it right over to you, Sarah, for our next section about data sources and how to search for data on Healthy Northeast Ohio.
Thanks, Libby. Bear with me while I pull up. Libby, a thumbs up. Are you seeing browser?
Yes, now I am.
Okay.
Yep.
Okay. Is there a delay?
There was a slight one,
Okay.
but I think you're good now. Yep. Thanks.
Okay. Thank you. So thanks, Libby, providing that overview. In the next portion of our demonstration, I'm going to mainly be focusing on the Explore Data tab. And I'll just be showing you some of the indicators, the dashboards, and then two of the data-related tools that we have available to you. And then, as Libby shared, the website centralizes population health data, and that data is routinely updated. It helps to allow for comparisons and then also collaboration. So I thought I would start by showing you the indicator list by location. So again, that's in the Explore Data tab. So I think even if you're new or not to the platform, this page can be really useful. So this lists all of the 300 plus indicators that are available on the site, and it shows what geographic levels are available for each indicator. And as Libby mentioned, the data on the platform is available at the state, the region, county, city, zip code, census tract, and neighborhood levels. And I would say most of the indicators are available at the county level. So I'll scroll just a little bit, but you can see that this list is organized by topic and then also by subtopics. And these do align with the Healthy People 2030 framework. So again, it's just a good place to come to kind of get a sense of what data is available to you, or if you have a particular topic that you're interested in to kind of, again, get a sense of what indicators are here. So going with that thought, if you did have a particular topic in mind that you were looking for data on, maybe it's heart disease, you could scroll down, so bear with me. Go. So this is our health and heart disease and stroke topic and subtopic. And again, just giving me a sense of what we have available. So we've got some indicators around blood pressure, cholesterol, stroke, heart disease, adults who visited a cardiologist, etc. So say I saw adults who experience coronary heart disease and I was interested in learning more. If you look to the right, again, you can see the different geographies that that particular indicator is available at. So I'm just going to go ahead and click on that indicator. And then if you're new to the platform, you'll see that when you do click on an indicator, you're going to be prompted to select a location. So for the sake of example, I'm going to go ahead and Ashland County. So now you're on the indicator detail page, which Libby quickly referenced that was in our FAQ. And on this page, this is really where all the nuts and bolts are about each specific indicator. So at the top, you can read more about what this particular indicator is, and then some text about why the indicator is important. Again, just to kind of help with that context. This language might be helpful to you if you're writing, for example, a grant proposal. And then just below that, you are going to see the current value for Ashland County, and then any comparisons that are available. So for example, comparisons to other locations, other values, and then also how that indicator is tracking over time. And you're going to see that the website does use a few different gauges and icons and colors to help compare and trend the data. And just like a couple tips for you, especially if you're new to the platform. So here we're looking at how does Ashland County compare to other counties across the state, other counties across the country. And you see as I'm hovering, these pop-up boxes are showing just to kind of help with that interpretation. You can also see how is Ashland County comparing to the overall US value or the prior value. And to the very left of the screen, you'll also see that we do have a legend that's available to you. You can just click it. And again, that kind of breaks down the color coding used on the site and then some of those gauges and dials. And then just below the current value right here, if you my mouse, you'll see information about the current measurement period, who maintains the data, what the data source is, like this indicator's coming from the CDC places, and then when it was last updated. And then if I scroll a little bit more, below those comparisons, each indicator will have a change over time graph, so we can how this indicator is looking over time. And as Libby mentioned, just like in the demographics specialty dashboard, these graphs can also be downloaded just by clicking this hamburger symbol. If this indicator happened to have subgroup data available, example broken out by age or gender, race, ethnicity, if you can see right here, hovering, there would also be check boxes listing those, and there would be graphs showing for those as well. And then if I keep scrolling, below that change over time graph, there is going to be a map available. So here, this is showing Ashland County and then the other counties within the Healthy Northeast Ohio region. The tabs above the map, again, just show the different geographies that are available. So if you were interested in looking at this indicator at the zip code level, you could click that tab and then that map would adjust. In these maps, you can do things like turn the labels on and off. You could change the background map and also the transparency map. You can also zoom in or out, and then you can also export the maps, just like the graphs on the and throughout the rest of the website. And here again, we're just seeing how Ashland County is faring compared to the rest of the region. And then there's also always a data table at the bottom of the indicator detail page that you can review. And then if you're interested in actually downloading the data to use on your own, you can do that at the bottom or towards the bottom of the indicator detail page. It's always right below the table. You see where my mouse is, where it's download county indicator data, and that will allow you to download it to a CSV file. And then lastly, just to follow Libby's lead, another way that the website does bring together related content will be at the bottom of the indicator detail page. So say you were interested in looking at some other indicators to get a more well-rounded picture. So other indicators related to that I've selected here. So here we adults who experience stroke, adults who visited a cardiologist. So you can click on those to dig deeper. And then if you were interested in exploring promising practices related to indicator you've selected, those are also listed, as well as other resources as available. And then before moving on, mainly for the people who never used the platform, I wanted to just quickly mention outside of sort of searching for data in the way that I just demonstrated, you can also use the search for data and curated dashboards page. So there's a spot where you can do a keyword search. And there's also drop downs if you wanted to do a search by a location or for a particular indicator. And then if you went back to the home page, there's also a search bar on our home page. So again, just wanted to throw out those options to you as well. So moving on, next I wanted to cover the specialty dashboards that we have available on Healthy Northeast Ohio. And a dashboard is just a collection of indicators that could be around a topic, a location, or another element. And I know Olivia already showcased the demographics dashboard, so I won't do that. But just wanted to mention that this is probably one of our most visited pages on the site, I would say. So I would encourage you to check that out at your leisure. Another specialty dashboard that we have is our disparities dashboard. And this would be useful if you are interested in looking at differences in health between groups, because you could use this dashboard to help identify those groups to potentially focus your program or maybe even policy efforts toward. And what this dashboard does is it includes all of the indicators that have subgroup data available. It's mainly by race, ethnicity, age, and gender, but there's some additional breakout data. And you can use that to identify populations who might be disproportionately impacted. And just keep in mind that the availability of this breakout data does really just depend on the source that the data is coming from. So just like the example that I showed you of the indicator detail page, not every indicator will be included in this list. And you're going to see up top, just like in the demographics dashboard, that there's a drop down where you can select a particular location. The default just happens to be the state. So I'll scroll a little bit so we can see what this looks like. But basically you can see how values differ amongst various subgroups and then how those subgroup values compare to the overall value for the population. So you'll see the overall will be at the bottom. And then breakout values that are significantly better than the overall value are highlighted in green. And then those that are significantly worse than the overall value will be highlighted in red. So we're seeing that here with the age-adjusted death rate due to breast cancer, that the rate amongst Black African-American population is significantly worse than the overall value. And again, this is just for the state of Ohio for the sake. That is the disparities dashboard. And then the last specialty dashboard we have is the Healthy People 2030 Progress Tracker. So this shows how a location that you select, again, using the dropdown, compares to these national Healthy People 2030 10-year objectives for improving the health of all Americans. And you could use this dashboard to help you set goals for your programs, also to compare how your community is doing compared to these national benchmarks. And again, this will only include indicators that do have a Healthy People 2030 target. And I would say that this is probably the easiest dashboard to navigate and understand what's going on, because there's really only going to be two icons. So you're going to see a red X if the location you've selected is not currently meeting that Healthy People target. We'll see if we can find a green check. Here we go. So you'll also see a green check if the target is being met. So those are our specialty dashboards. And I also wanted to mention, in addition to those specialty dashboards, we do also have several curated dashboards, which really are just pre-built dashboards that Libby and I can create on the back end of the website. And again, if I went too quickly, that was explore data, search for data, and curated dashboards page. And this is where I mentioned that you can also search for data on the site. Just a little bit. We have a mix, so many of these dashboards are topical, and they just include data that is maintained by our vendor Conduent on the platform. So you can have one basis, one pertaining to digital access, and then another pertaining to social determinants of health. But then we also can add local data to the platform, and we're able to create these curated dashboards to house local data as well. So a couple examples of that you can see. We have an early childhood health and well-being dashboard. That includes a couple Ohio Healthy Programs indicators, as well as some health status data from Better Health Partnership. We also have Cuyahoga County childhood lead poisoning data, and then a couple indicators from the 2019 Cuyahoga County CHNA. So again, local data can be added to the platform, just kind of putting that plug in. If that's something that is of interest to you, feel free to reach out to Libby and I. And then next, Explore Data tab, you'll see that we have a socio needs index suite on the About page. So if you've been on the platform since the spring, this will be familiar to you, but if not, this is a suite that our vendor Conduent launched, I believe in March of this year. And this is a tool for assessing, planning, and collaborating on community health. And it can be used to identify under-resourced areas down to the zip code or census tract levels. And what's nice is because that data is available at a sub-county level, it can help you to be more specific when you're planning local prevention or early intervention efforts. And all of the indices in this suite include maps. So you'll see that in the maps, the darker the color, the higher the relative level of need within that particular community. So at the bottom here, you can see the 3 indices that make up the suite. So those are the Health Equity Index. And if you are familiar with the platform from last year or prior, this was actually called the Socio Needs Index. But the Health Equity Index is a measure of socioeconomic need that is correlated with poor health outcomes, including preventable hospitalizations and premature death. And this index can be used to identify areas at highest risk for experiencing health inequity. Second is the Food Insecurity Index. So this is a measure of food accessibility that is correlated with economic and household hardship. And this index can be used to identify areas at highest risk for experiencing food insecurity. And then lastly is the Mental Health Index. And this is a measure of socioeconomic and health factors correlated with self-reported poor mental health. And this index provides a visual of mental health in the region, and it can also be used to identify the areas at highest risk for experiencing poor mental health. So for time's sake, I'll just go ahead and show the mental health index. And again, this can be used to identify the areas at highest risk for experiencing poor mental health. So at the top, you're going to see a description of the index and a little bit about the methodology. And you'll see that each of the indices in this suite also have this how does it work button that you can click on to get more detail. But kind of in a nutshell, all counties, zip codes, and census tracts are given a national index value, and those range from 0 to 100, with 0 being low need and 100 being high need. Then those national index values for each location in a community are ranked from 1 to 5, with 1 being low need and 5 being high need. So here we can see the zip codes in the region are ranked, and the darker the purple, the greater the estimated need. And I was going to also mention below the map, these can be filtered. So if you were interested in just looking at a particular county, you can select county, select Summit County. And then here you can see the zip codes within Summit County. If you wanted to look at the census tract level, you could also do that using those filter options. And then the same with the maps on the indicator detail page, you have those same options as far as labels, the background map, and then also exporting this. And then just below the map, you'll also see a graph of all of the zip codes in Summit County since I made that selection, as well as a table. And then just above the table, you can actually download this data again to a CSV file if that is of interest. All right, so the last thing that I'm going to be focusing on today is the two data related tools that we have on the website, and those are the option to build a custom dashboard and then also to build a custom report. And you can use these tools to help tell the story of your community or to help make sense of the data. I did, time's sake, created a sample dashboard just to show you what this looks like. But a custom dashboard brings together data in one place, and it shows a summary of the selected indicators as well as any of those available comparisons, similar to what we saw on the indicator detail page. So, these can be used to help identify areas of progress or need within a community. Also, they can help with driving collaboration because they are easy to share with partners, and they allow partners to use common data for measurement and also for tracking purposes. You could use this tool to help with things like reports, presentations, publications, or even a grant application. And when you create a custom dashboard, it will be dynamic. So if you save a link to it, which I'll show you just a moment, and you navigate back to that dashboard that you created, as new data becomes available, your dashboard will actually update automatically. So again, these are dynamic. And then there's two views for these custom dashboards. So what we're looking at right now is the list view, which just is like rows, but you can also view these in a card view. And these cards are nice, particularly if you wanted to pop them into a document or a PowerPoint slide. So for this particular dashboard, I filtered this to Lake County, and I also filtered it to our diabetes pick. So again, looking at the diabetes related indicators available for Lake County. So in that second column, you're seeing the current value for Lake County, and then to the right, any of those comparisons that are available. And just like in the indicator list by location, you can click on these indicators to be taken to your detail page. So if you are interested in creating your own dashboard, I already sort of showed how to navigate to it, but I'll show once more. So the Explore Data tab and then build a custom dashboard. And you can create these by either using the filter indicators option, which is what I've done here, or the handpick indicators option. So the filter indicator option is best if you just want to filter by a particular topic area rather than have very specific indicators. But you can see here, there's a field for the location, which you can include multiple locations, the same with the topics. And then there's other filters that you can add as well, like comparisons, subgroups, and data source. And then all you would do is just click search. And then lastly, to save your custom dashboard, right below search results, you can just click save a link to this search, and then a URL will be shown that you could then copy and paste either into a document or an email if you wanted to share it. And the second data related tool is the option to build a custom report. So this tool is called the Location Report Builder, and it allows you to build these reports based on indicators and a location of interest. And it is a pretty easy way to quickly pull together different components on the site into one downloadable PDF. Again, these can easily be shared with others as well because you can save them. And I wanted to mention that unlike the custom dashboards, these custom reports are more static. So they're just a snapshot in time. So whenever you created your report, that's what the data will reflect, and they're not automatically going to be updated. So we get asked like, well, what are some examples of custom reports I could create? So we've created some for our county's demographics. You could do like a community profile. You could create a report around a particular topic or a priority, etc. So here I have created just another example, which focuses on housing in Lorain County. So you could see just some of the different component options that you have available to you. So here I've included a description of the indicator, the source. This is actually that indicator card that I showed you, changeover time graph, and then also look at this particular indicator across the region. So again, that is a custom report. And for time's sake, I'm not going to walk through the whole process, but I'll just select a location. So again, this location report builder, and you can access that by going to Explore Data, build a custom report. So if I selected Geauga County, now you're actually in the tool and you see the toolbar here. You would just click indicators to start searching for indicators, and keep in mind you do have to add them one by one. You can also add demographics data, information from the Health Equity Index, a map of your location, etc. And then when you're finished, you would just click the save icon, and that's how you could download it as a PDF or save it to your browser to access it later. So I think that covers all of the data related tools that we wanted to provide in our overview today. So I'll stop sharing and turn back over to Lou.
Thanks so much, Sarah. And before we move into the last part of our website demonstration, where we will look at a lot of the tools and resources available, we do have our second poll open and ready for your participation. So again, this is through menti.com, and I wrote down the code this time since I wasn't able to see it last time, but that code again is going to be 2204 2086. And we are wondering, how have you used the data on Healthy Northeast Ohio? And if you have never visited healthyneo.org before or are brand new, you could maybe share how you anticipate that you might use some of this information that we've shared this morning. So we'll go ahead and leave this open. These should be open-ended. This should give you the option to answer these questions open-ended so that you don't have to pick specific things. So it looks like we have a couple of responses, which is great. So for grant applications, I haven't used it yet, but I'll be using it in our upcoming community social services needs assessment. That's great. To complete our CHA and for information on grant applications, information about have pulled county indicator data and used lists to develop a plan for tracking CHIP indicators. All great responses. Quality improvement projects. We'll leave this open for just another moment or so while we let you all participate. It's great to hear, and it's always really useful and impactful for Sarah and I to hear how site users are utilizing healthyneo.org. Again, we are local site administrators, and we would like to be very responsive to our partners and to those who are utilizing it. So any opportunities that we can enhance your utilization of it or support your own local efforts through what we have available on the platform, we're always very happy to engage in those discussions and collaborate. Okay, so it looks like these have slowed down a little bit. If you are still filling that out, please do, and we do review those after, so that will always be helpful for us as well. But we are going to go ahead and move into the last part of our demonstration. I'm going to go ahead and turn my camera back off just for bandwidth purposes, and I will go ahead and get my screen shared once more for the next component. And Sarah, if you could confirm whenever you see the screen, that would be great. Thanks so much. Okay, great. So we are going to take the next couple of minutes to preview our tools and resources that are available by navigating to this Tools and Resources tab. And if you hover over it, you will see those different pages that are available. And I'll mention some of these other ones in a few minutes, but I do want to visit and take you physically to a couple of these. And that first one that we'll preview is the Promising Practices database. And so this page includes more than about 2,000 successful health and quality of life programs, and these promising practices are ranked as evidence-based practices, effective practices, or good ideas. And this is a great tool. We do not maintain this locally. This is actually maintained by our site vendor. So if you were interested in learning more about their methodology for ranking and vetting those programs, you could click on that ranking methodology hyperlink here. We also, again, even though we don't maintain this, we always encourage our partners and site users to submit a promising practice if you have something really fantastic that you're doing. We know there's a lot of really great work happening in Northeast Ohio, so if you are interested, that is certainly an option as well. So on the promising practices page, we know again that there are over 2,000 results, which is quite a few to go through if you are looking for something specific. So we do always encourage using these filter options that are available. You can search by keyword, you can filter it by ranking. So again, if you've been visiting the site and you've been learning a lot about nutrition or food insecurity, and you want to take it to that next step by looking at some program planning opportunities, this might be a really effective tool in doing so. And for the sake of today's time, I did go ahead and prepare an example already. And so I went ahead and did some search filters for food insecurity. I selected only evidence-based practices targeting adults. and I left it at that. So here we can see that it actually reduced our options to just about 17. So that might be a much more comfortable number to start that search at than the over 2000. And so right off the bat, we always recommend saving a link to the search, especially if you are looking to share this with a partner or a coworker. And again, even 17 might be quite a few to get through in one seating. So we do encourage you to save that as well. And if you go ahead and click on any of the promising practices, they're all going to look pretty similar. I'm just going to click on this first one here, but you will see that different information is listed, such as the description of this practice, goal, mission, impact, any results affiliated with it. And one of the great aspects of this page that you'll see on all of the different promising practices is that you will actually see contact information of the entity or organization that submitted that. So again, if you were interested in getting started with something similar, this would be a great place to start and to view that information. At the bottom, we have another example of how intuitive the website is at bringing content together. So here we have some indicators listed that are related to this promising practice, maybe some reports that are housed in our resource library, any other resources that are available there as well. And if this wasn't exactly what you were looking for, but you felt like this was on the right track, you could click through in this related promising practices box. You can always, of course, go back to the previous page, but this might be an easy way to view some promising practices that are related to the one that you were currently viewing. So again, that's a little bit about our promising practices database. And next up, we are going to take you to our resource library. And so this again is underneath our tools and resources tab. And this is maintained locally. So this is maintained by Sarah and myself. And we have, I want to say, about 400 or so different reports, presentations, webinars, toolkits, websites, etc. And what I just clicked there was our filter option for that as well. So similar to the resource or similar to the promising practices database, this might be quite a few to go through. So if you wanted to narrow down your search in our resource library, you could click that icon in order to select some filters. We also have a keyword search, which you can utilize. If you click on any of our resources that are in this library, it will take you to that specific page. We have a little bit of information about the topic that it's related to, when it was posted, and then we have some information about that resource as well. So perhaps who the author is and so forth. And we also would like to briefly just point out our collections. So this is a great way, again, if you're brand new to the site, this is a great way to pull together some resources related to a specific topic. So if you knew that you were interested in information about health equity or social determinants of health, you can click on those topic titles and that will pull up the collections for that specific area. And again, since we do maintain this locally, you can submit a resource to the resource library, and you could do so by clicking here, and then Sarah and I would review that and potentially get it added. So please do consider that if it is of interest. We're happy to review those. There are a couple of other tools and resources that we'd like to just mention today. We have a couple of COVID specific pages, a COVID-19 resource page, which has some data and information. We have a COVID-19 vaccine readiness page as well. We have an emergency preparedness resources page. There's also a funding opportunities resource page, and this mainly includes funding opportunities from the federal government and from larger foundations. And this is also maintained by our site vendor. But again, a great resource if you're looking for funding opportunities related to a specific health or quality of life topic. We've already shown you these next two, the promising practices and resource library tools. And we also have some 211 resources listed for all of the counties in our region. And then the last resource that I will just briefly mention is our Community Health Needs Assessment Guide. And this is a step-by-step guide for conducting a needs assessment. And this is again maintained by our site vendor. So again, just a couple of different resources that can be really helpful in supporting your community health improvement activities. And they can also be very helpful to supplement the data that you might be looking at when you're visiting Healthy Northeast Ohio. And as we begin to wrap up, there are just a couple of final items that we'd like to point out. So under the Learn More tab, we have quite a few different resources that we'd like to highlight. We have an About Us page, and this contains some information about our efforts. We have some press releases here. We have our newsletters archived, and we have our success stories there as well. So I believe I mentioned those right at the beginning, but we have started documenting some opportunities that our local partners have utilized and seen success in using the website to support their efforts. So those are listed here. And we also have some information about our history and how we got to where we are. Of course, we have information about our team, our partners, and then the other page that I like to mention here is our How to Use This Site page. This includes some really great how-to documents. We have video tutorials as well. So, for example, I know Sarah did a great job of covering that custom dashboard and custom report opportunities through the Explore Data tab. If those were things that you are really interested in learning more about, and if, of course, you'll have this recording, but if you wanted to sit down and do it again step by step, we do have a video tutorial for those items in this page as well. And also on this page, we have some resources on how to get involved. So if you are interested in having our Healthy Northeast Ohio logo on your page as a widget for your organization, you could visit information on how to do that and how to use this site. And then we also have information there on how to even have a mini dashboard available on your web page. And I believe Sarah mentioned earlier, there are some opportunities to add local data to the healthyneo.org site. And we have some information and FAQ documents about how to go about doing that as well. So again, lots of great information in this how to use this site page. And then, of course, if you wanted to contact us, you could do so through this webpage as well. And I believe that concludes our website demonstration portion of the webinar. I'm going to go ahead and pull up our last final slides as we conclude our webinar for today. Sarah, can you confirm that you're seeing our wrap-up slides? Okay, thank you so much. So I know you've seen a lot of information in this last hour about the different data indicators and indices that are available on the website, demographic variables. We've looked at some tools and resources on Healthy Northeast Ohio. So again, we just encourage you to visit the website, to share it with those that might find it useful, and of course to reach out to us if you had any questions or were interested in further collaborating. And as we open it up for questions, we will go ahead and leave our contact information here for just a moment. Like I mentioned, we can be reached through the Contact Us page on the website, but you can also reach us via email directly here as well. So we will go ahead and leave this up as we conclude today. And we do not have any upcoming events or webinars scheduled, but if we do have any, those will be listed on our website. And we highly encourage you to sign up for our newsletter. And this is something that you might get a pop-up for right when you enter healthyneo.org, or if you scroll to the very bottom of the page of any page on the site, you'll have an opportunity to click on newsletter and get signed up for that. So it is quarterly. We do highlight new features, if we've added new data, any, again, events and things like that. So we do encourage you to sign up for that. And so with that, we will go ahead and open it up for any questions. I know I have the chat open, so if there are any specific questions, please do feel free to add those. Sarah, I know one of the very frequent questions we get asked when we've done presentations is how frequently the data is updated on the site. So would you mind maybe touching on that as folks are thinking through some of their questions?
Absolutely. Yes. So I feel like we get that question almost every time we share about the website. And I would just say that majority of the data is updated on an annual basis, but it really just depends on when it's released from the data source. So say it was an American Community Survey, whenever that data was released by the Census Bureau, it's typically up on our platform within 6 to 90 days.
Thank you. Thanks, Sarah. And I'm not seeing anything else through the chat. We, of course, will, of course, give it another moment or two. And we know that everybody likely has a busy we can go ahead and conclude to a couple minutes earlier, but we will be sending out this recording. So for everybody who registered and attended, you will get this recording link. And we, of course, encourage you to send that out as you see fit. So sharing it with partners in your network or those who work in your organization. I'll also mention that Sarah and I are available for tailored presentations as well. So if this overview was helpful, but you wanted to take it a step further and look a little bit deeper at something and you were interested in a staff training or something a little more in depth, we're happy to collaborate on that as well. So with that, I will go ahead, and I'm still not seeing any other questions, and that is perfectly fine, but we will go ahead and conclude. So thank you so much for attending today. We appreciate your participation, and we look forward to engaging with you soon. Have a great day.
Thank you, everyone.